I think we are okay from our end.
I think we'll wait for some more time.
So I'm going to be talking about acromegaly. What is acromegaly? Acromegaly is a condition of growth hormone excess adult patients. So if there is a growth hormone excess below 18 years of age, it is called gigantism. If it occurs after 18 years of age, it is acromegaly. What happens is because the bone is used, there is no chance.
Manish, would you like to start?
I think people, we still have to, I mean, there's not,
Yeah.
except I think Jyoti is also from your team. Or?
No, not from
Jyoti,
Yeah.
So still, I guess we should wait for some time and then start.
Okay, let's give a couple of minutes and then start.
Sure.
Yeah, it makes such a noise that we managed to get 300 plus audience.
Wow.
But we had to do that. Joydeep, so and it came out very well.
Yeah, so I was there for a while, but then it went past.
Top, the thing is, the way you also farmer industry funds it. So we have a foundation, Idea Foundation. So almost for the conference, we generated 10 lakhs. The whole thing, they have those grants.
Correct.
So,
Yeah.
and it hardly costs anything for us.
Right. Yeah.
So now we don't have to pay for travel and all that.
No,
So-
it's become more
Right.
cultural.
Yeah.
So,
So poor response.
well, this is expected from people now, I think.
So good evening, Jyoti. Can you hear us? And people from grassroots, people consulting. Do you hear us?
Yes, good evening. Good evening.
Hey, Jyoti, I'm so surprised to have you. Because your name is only featuring as Jyoti, so I did not know which Jyoti it is.
Okay. I'm just on my way to my house.
You are on your mobile phone then.
Yes.
So just to introduce Jyoti, Jyoti is one of the HR director in Volvo. Volvo, right, Jyoti? I think she's gone.
Yes, that's right.
Yeah. So she was working with me in AstraZeneca.
Right.
So they are again in news, big way, AstraZeneca. And grassroots team, are you there?
Yes, Krishna Shankar here.
Oh, Shankar.
Yeah.
अरे तो ये पूरा बेंगलुरु गैंग है. Beंगलुरु gang. Yeah, nice to have you, Shankar.
Yes, very much here. So,
So yeah, Dr. Sham is here. He's a leading endocrinologist in Hyderabad.
okay, great.
My friend Manish is here.
Hi, good
Hey,
evening.
hi. Very
Joining.
nice to catch
Yeah,
up with you.
yeah.
Both Shankar and Jyoti are our AstraZeneca colleagues, my AstraZeneca
Awesome.
colleagues.
Yeah,
So Mr. Nikhil Tigala,
yeah,
are you there?
yeah. I think everyone is on mute, so I think, yeah. I think we just follow minutes.
My wife has also joined, Nitya.
Nice.
Vamshi will join.
Yeah.
Vamshi is joined.
We can get started, yeah.
Yep. Okay. So I think let's get started. I think it's really heartening to have you all on board today here. And good evening to all of you. And it's indeed a pleasure to host the fourth Assurance Talks. I mean, we had the first Assurance Talks where we had a story of an incredible story of a person who survived leukemia, and so much so that he's just as normal. Then we had a couple of more sessions on how to manage COVID. I have experienced in the last three sessions is that it has given
Krishna, you were on mute.
Oh, 1 minute.
Yeah, that's
okay,
fine.
sorry. Yeah, so basically, I was just telling health is generally a very important aspect and also often neglected aspect. In fact, just before this session, we were talking. The doctor was also saying the same thing. I think when you go abroad, especially in the Western world, health is seen so seriously, and sometimes they really work hard towards maintaining good health. But when it comes to India, we sometimes have a very neglected attitude. And I mean, I'm an HR professional with having served in many companies, and one thing which I have seen is a lot of these companies indulge in the feel-good factors of health checkups and yoga, Zumba sessions, and all those things. And so often these becomes a tick box item, and once the act is done, it's just forgotten. Okay, and I'm sure all my HR professionals who are here, we struggle a lot even to ensure that such are some of those initiatives are sustained in the organization. It doesn't happen. Okay, and it's only when we suffer something, a serious issue, and that's the day when a lot of people wake up. And I have some very powerful stories of past where just because we realized something in time, things changed. Otherwise, they would have been a big disaster. Okay. So that's the one of our focus of Assurance Talks is that how can we create a sensitivity around health aspects, and we bring in people. And today we have brought Dr. Sham here to help us understand some of these issues and how to really lead a healthy life. Just before we started this session, there are times when you hear people saying, like that I need to be really healthy even as the age goes by. And that is not an overnight affair. You have to start now. Okay. So with this, let me first introduce Mr. Manish. Manish is a good friend and a neighbor, and who heads the Nano Health, and we have been many years. I mean, almost from ISB days. Okay.
Yeah.
So the uniqueness of Manish is that he's a IIT engineer. I mean, from Bombay, IIT Bombay, and then ISB, and now he, swayed it. I mean, he just got into this health space, and he runs a company called Nano Health. And we'll talk a little more about this, how Nano Health really is making a lot of difference to corporates in ensuring a good health. And Dr. Sham. And Dr. Sham is here, who is the leading endocrinologist, as I say. And with this, may I request Manish to initiate, and then we will go to Dr. Sham.
Yeah, I think so. See, the whole point of assurance talk is that how can we assure people in large organizations that they can be the prime of their health. So though we are actually doing a lot of activities, but still the impact is kind of limited, and that's where I think we believe the biggest gap is. So I mean, Dr. Sham, is here. We have known each other for a while, but I'm one of the best doctors, which I can really vouch for. But how is we are eager to learn that how can you and your organization, Idea Clinics, is actually making an impact. There are programs which I have come to know about, which is called diabetes reversal program, and of course apart from managing like uncontrolled diabetes. So I think so that's one aspect of it, and would also like to understand that how can we actually take it to a scale, because there's a difference between, I would say, an individual and an organization is like suddenly one individual become 1,000 people, and when someone when organization would look for is like how can I ensure that the best of the care or so-called preventive health is being provided to my employees at large. Yeah, Dr. Sham. Yeah.
Hello, good evening. I'm Dr. Sham. I'm one of the endocrinologists based out of Hyderabad. I trained in the UK, and then I'm part of Idea Clinics. So to begin with, what I can say is we all agree that our strength is our population. We all believe on our demographic dividend. We are a nation of youth. And in fact, the reason we escaped the full-blown impact of COVID is because 90% of our population are below 60. If you see the Americans and Europeans, you see the age factor that is going against them, apart from other factors like weather and all that. So keeping in mind, our future is investing in our youth. So, and unfortunately today, what is happening is we Indians, we are living a decade lesser than the white population. We are dying, our average life expectancy is below 70 years, which is quite bad. The Americans and Europeans live till, so we after all, we have only one life. So premature death is something which is hurting us. And historically, what used to happen is health industry used to be under the purview of doctor community. The IT sector used to do something else. We are glad that technology is bridging the gap between all our different specialties and organizations. Like today, because of technology and money, nano health, we could interact with the HRs across India. So what I'm trying to say is we need to keep our nation healthy, and as part of that, HR takes the major chunk of keeping their employees healthy. In that regard, I think over the next 15-20 minutes, we will talk through how we can, make use of technology platforms and bridge the gaps between different specialty areas, and try and make sure our staff remain healthy, so that we are more productive and much more successful in this globalized world. I think over to you.
Yes, thank you, doctor. So one of my challenges has been that in organizations we need people to have a sharp mind, and often in the meetings I want people to really grasp data and respond spontaneously. I mean, this is not a no-brainer. I mean, I think it's not like I'm dropping an esoteric stuff, but it's a very practical thing, But just imagine if you don't have a healthy body, your mind will be healthy, and your ability to kind of understand the complexity of issues and respond becomes a challenge. Okay, and I think today obesity is another common thing, and so many things that follow through the obesity problem. Like today pizza, burger, and my beer is making me really. Although I feel very happy at the end of the day, but then end of the month or end of the year, I really pay for it. I mean, in a very different way. And these are things which will continue, because as long as the urge to urge to eat and urge to drink and all those things will continue, it will continue. But at the same time, it is possible the reversals. Like for example, in the first nano health, first assurance talk, we had this leukemia patient who, after 14 years, just says, I'm as normal as anybody else. And the doctors are saying, no need. I mean, if leukemia can just get reversed like this, I'm sure there are many other diseases can be reversed. And today, I think diabetic is one big issue for many of us, you know. So can you just highlight something, how some of these reversals can be done, sir?
Yeah, interesting question. Diabetes in Indians is happening at least 10, 15 years early compared to white man. So most of our IT guys, they develop diabetes in their 20s and 30s. The problem is, leave alone the burden of the disease, we are getting it at a younger age. So when you become diabetic at a younger age, we are prone for the complications, you know. So by the time we reach 40, 50, most of us might end up having cardiac events, needing a stent or bypass. And the biggest reason for kidney failure is diabetes. One of the big reasons for blindness is diabetes, whether it's sexual health, foot problems, paralysis. So this is the reason we are talking about premature death as a consequence. So diabetes prevention is one of the major cornerstones, because after all, we are number 2 to China in terms of population with diabetes. So first thing, as HR leaders, people like you should ensure that your employees remain healthy. Whatever physical, emotional, dietary, whatever support you may have to provide. Luckily, with technology on board, these are not expensive. I presume these are the ways we need to ensure. So we need to make sure our staff do not end up with diabetes and obesity. These two will knock off 10 years of our life, similar to smoking habit. All these lifestyle changes we have to work on. So diabetes reversal is a program for people who are already diabetics. So we can ensure with lifestyle changes and all the support, we can get rid of their diabetes in most situations. And in that sense, I think we need to help our staff with technology support and whatever it needs to make sure we keep our staff healthy.
Yeah, in fact, I think you talked about reversal things, and I have a very practical real life experience. One of my colleague was diagnosed as a high risk cardiac patient. His wife was counseled by the medical team. I mean, this happened after we had done the medical checkup in the company. And fortunately, at one early morning when he complained of some discomfort, his wife knew there was something serious. It was not like a gastric problem. It was not like something of very routine. And he survived. And today he's doing very well. In fact, he heads the HR of one of the large companies today. And I'm sure a lot of time we just think, oh, can I just take a couple of Digen and wait? Can I do this? Can I do that? And once the golden hour is gone, it's just impossible. Okay. And also, I have another very serious issue where there was a head of sales and marketing who suffered a cardiac problem, had to undergo a bypass surgery, and the doctor said, for next 6 months you should stay away from work. You should just focus on your survival. And companies don't wait. They don't wait for even for 6 days. I mean, if somebody is not there, I mean, they would rather replace somebody. We replaced it. We replaced another good person in that place, and this person had to move to corporate communication, and today his career is gone. Uh, and he was diagnosed as a high risk hypertension patient, okay, and he was told that he has to follow a certain regimen. And why did I highlight this in this space is that many of us HR people, and like I was just saying in the beginning, we do a health checkup and done. Okay, we have covered all employees, we are happy. But what happens after that is where the missing link is. And here I would bring Manish here, and Manish is from Nano Health, and they maintain a scorecard. They maintain some kind of a dashboard, and they maintain they are able to predict what are the challenges that the individual will have and the organization as a whole will have. And this possibly will impact not just your sick leave, and it will possibly reduce your insurance issues, and at the same time it will also increase your productivity and employee engagement. So Manish, can you just highlight what it is?
Yeah, so I think already all I would say the services are available. We know the problems that are coming. I mean, a very important point the doctor mentioned is like 15 years. We on an average we are getting diabetes, let's say 15 years before. So we are actually doing, many of these activities on the ground as well. For example, annual health checkups are happening. The doctors are available in the hospital. We are doing Zumba session, we are doing yoga sessions, and many more activities, wellness activities like that. So what's effectively missing, right? So what is missing is the linkage between them, right? So, and what we have found is, just by, doing annual health checkup and making sure, just doing the stratification of the people and their risk over, like, high risk, very high risk, and so on. And then making sure that, there is a good follow-up. Now, there are things that can be managed just by a general practitioner and MBBS doctor, but there are things that can, where we do need a specialist doctors like Dr. Sham and his colleagues, and that's the stratification that actually allows us in making sure that any of those extreme activities which could actually lead to the claims, right, can be reduced significantly. So it's a win-win for all. So at first, there is an employee who would, most likely will not be sick enough to go to the hospital, and can be, will be a lot more active at work, and most of the services are also being provided at the workplace. And now that's where the technology plays another important role. That, like, many of these services, you don't even have to, like, go somewhere, using teleconsultation. The experience is as good as, let's say, you are in clinic, right? And like, so Dr. Sham has been able to adopt that, to actually able to provide that, at work. So that's number one. The number two is that, it's not like things like diabetes, thyroid and all. I mean, it's not like a one-time thing. It's not like, once you're done, you're on medication, and you're done and you'll be good. I mean, there is a constant follow-up that is required for it. Like, you need to know after 3 months that whether, the medication that was given, whether actually that led to the reduction in the sugar levels in the body or not. And that's another part that we do effectively through our nurses. We ensure that, there is a follow-up that is done. And if it is not controlled, we go back to the doctor. Then, hey, it's time to go back to the doctor. So, and this kind of goes on, right? And and that's where, so it saves a lot of time for the employees, because they don't have to spend, let's say, half a day to actually go out. It saves a lot of time for the organization, because now they are able to actually do things over there, because anyway they are spending on those things, those activities today. We just make it a lot more efficient and more effective. And plus the dashboard that you say, it just makes it like a number driven. We are not saying that, hey, so I am providing the service and I'm good. We are actually able to show that the number of people who actually become healthier, number of, activities that is happening, how many teleconsultation happen, how many, actually follow-ups happen, how many people with actually diabetes are now back to normal compared to, otherwise. So yeah, so basically it's the point is about how can we make the whole thing efficient at scale. No, I mean, so doctor, I mean, like, this is, I mean, in the other countries, or, like, given your experience here, like, what has been, let's say, the average age of, people who comes to you, with, who has been like a diabetic for how many years in the past?
Yeah.
So, yeah, if you can throw some light on that.
See, what I think is, one of the advantages in India is there is a lot of entrepreneurship, lot of there are a lot of people with lot of new developments. I think we may find solutions for global platforms. Now we are talking internally at our level, but bottom line is, Indian middle class is going through a lot of health issues, whether it's related to stress, lifestyle, obesity, diabetes, anxiety, depression, whatever you may take, mental health, physical health. So, and there is only one way to scale it up, through technology. I think we will pause here. Let's take some questions from some of you. Now that you have a gist of what we as a group are trying to fix for India. Anybody has any queries, any suggestions for us? I think it's something we can use as a learning tool between us. If you can share your thoughts on us.
Or may I request people who are managing large workforce or at senior levels to raise some of the concerns that they are facing.
So the challenges,
Challenges.
they may have, yeah.
Okay, looks like I think
So while we wait,
Yeah.
how do you see, as a doctor, I'm still anxious, how do you see the AI platforms, AI platforms in healthcare? How are they going to help organizations to fix their problems without having to physically visit a doctor in the long run?
Right. See, like given the advent of the digital health, right? I believe that even the doctors have a lot more 360-degree visibility of the health of the patients.
Yeah.
I mean, the patients today, I mean, like you would have seen, like there is a big file of all the data. I mean, I'm not sure, but I feel that it's tough to even go flip through all these things.
No, we moved from physical clinics to virtual clinics.
Correct.
From virtual clinics to AI technology platforms. Right. That's the next step we need to move on.
Correct. So basically, the AI is in some ways all the data driven, right? Based on the data, can we figure out all the lab things that they are doing, all the their compliance with data which they are inputting, like whether I take medication or not, the various kind of symptoms that may or may not emerge, right? Based on that, can we go ahead and predict in advance that this is the likely problem that may happen to the for the patient. Now even that helps, I would say, even the doctors in diagnosis, because many of these things are asymptomatic, right? So people may not know. I'm sure if they have symptoms, they'll come talk to the doctor and they will let them know. But the goal would be that how can we identify in time so that it can either be reversed or it can be prevented completely from happening.
Yeah, in fact, I think one of the things which I want this group to really think is where can the corporate and the medical come together? Basically, at the end of it, health is not a luxury. It is not like one of your Diwali gifts every year you give. No, it's not. It's basically something which is fundamental survival, and it goes even beyond the employee's employment within the organization. Okay, and I think that's where HR has a larger role to play to bring together the two partners, like the health,
Yeah.
the doctors, and the corporate, and with the technology, how we can bring that kind of a advantage to the organization. Yeah?
So yes, I think like the tomorrow's healthcare, I think a lot of this, as we are saying that tomorrow's healthcare will move to home. I mean, I believe that I'm of the opinion that a lot of this will actually move to the corporates, because 50% of all our time where we are away, actually we spend in offices, right? So and the value wise, the one of the biggest impact is going to be for the offices, right? I mean, because that's where we are actually generating real value, right? So so if we can provide, let's say, the best of healthcare, which is proactive, which is coordinated and continuous, right? So for example, if I am hypertensive and I don't feel a thing, right? So even if someone tells me on a measurement that I have found like live cases where I don't want to take a step to the left or right to fix it because I don't think I have a problem. But at the same time, and in our own experience, we have seen that if you are at a corporate workplace where there are doctors actually available, right? But if they can ping them, hey, can you come down and spend, let's say, 10 minutes with the doctor, and that's where they can make a huge impact with the doctors. And we have also been able to identify and predict who should even move from, let's say, general practitioner to the specialist, right? So I think those are the things I would say which can be done, and which will directly impact not only like you mentioned, reduction in leaves, sick leaves, improvement in effect efficiency or effectiveness of the employee on the work at the workplace. Then also reduce claims, right? Apart from utilizing the services in the right proportion, which at the right time, basically. Yeah. So do you see this transition happening, as we move forward, Dr.?
See, I think, to be fair, it's much more matured in the Western world.
Right.
In India, I think it's time people like, us to take it up.
Right.
It's more than anything, it's our responsibility. End of the day, people who have that, authority should take up on their sleeves and get this rolled out. Otherwise, what would happen is it's counterproductive over time. It's going to have, all that unnecessary. It will impact the overall output of the organization. In that sense, I think it is important because after all, if you see, it's rule of 10 now. 10% of young people are having blood pressure, diabetes, obesity, stress, anxiety, whatever you take, thyroid. For women, there is an entity called PCOD, PCOS, hormonal imbalance. So there's a host of problems for the employees. So I think as stakeholders, we should probably take up that ownership in fixing this problem. If you can share your thoughts, we might ask
Yeah, Jyoti, can you highlight? I mean, you manage such a large workforce. I mean, Volvo is one of the very big brands and also Scandinavian company. And I'm sure all of us who work with AstraZeneca know how the Scandinavians pay serious attention to the health. So, Jyoti, can you just highlight what if you have a couple of challenges there? Still mute. Still on mute. Anybody else would like to raise a concern or a challenge? Well, I think often one of my standard statement to Manish is health is still seen as a luxury many times in the country. So we have the Swiggy counter, Ola counter in the office, but we rarely have a medical counter.
Yeah.
And now after COVID, we have somebody testing the temperature, but maybe somebody has to test many more things before he enters the office.
Right.
So once we get that kind of a process in place, and that's one of the things which we are trying to highlight through the assurance talk, saying that yes, we are trying like hell to prevent COVID. I mean, every offices you go, they say that every shop without mask you can't enter, and they check your temperature. But maybe somewhere, this is an appeal to all of us here listening is, can we look at something of this kind even in our own organization, and possibly can we just browse through that idea?
Right. Okay, I think, if there are no more questions, then we can.
Anyone, any questions?
But I do believe that, given the time that each of the employees spend, time at the workplace, the responsibility has increased, especially after COVID. A lot more can be done on the ground than, let's say,
Yes.
it was done before. And earlier, maybe, the solutions were not available. Like, it was very difficult to get, let's say the specialist doctor of your stature to, let's say, get to the workplace. But now, we can definitely get a startup people who really need that care to, actually, let's say, consult with someone like you. I mean, it's as good as it gets in anywhere, pretty much anywhere in the world. So, we should definitely utilize that access and availability from either end. So yeah, okay. So I think if there are no more things, Shishti, we can close it.
Sure, I think the audience is being shy today. So,
Yeah.
very good session. Thank you, Dr. Shyam and Krishna, for joining us today.
Right. Okay. Thank you.
Thank you all.
Thank you all. Take care.